And welcome back to the show. Zipcare is a network of high quality and culturally sensitive urgent care facilities with convenient locations. Now, during COVID, our next guest took on the road of leading three of actual Zipcare urgent care facilities in Harlem. And joining me now is the clinical coordinator and lead physician assistant at Zipcare 365. We've got Dr. Michael Budden, and we thank you so much for being with us, Michael.
Hey, thank you for having me. Thank you for having me.
Glad to have you sharing. And, we talk about having a facility right there in Harlem, really leading the way. Talk to us about Zipcare and the work that you've been doing in the medical field.
Zipcare is the mandate and goal of Zipcare is to service the surrounding communities 5 to 10 blocks with a radius. Though we are urgent care, a lot of what we do is primary care and addressing a lot of the shortages that are apparent in the northern Harlem area. If you look at a Google search, simple Google search of urgent care facilities above, say, 135th Street, you're going to get maybe 3 things pop up. 2 of them are Zipcare, and 1 is another urgent care that's a little further away. So there's a void of urgent medical care unless you go to Harlem Hospital. But for the smaller things and the more urgent pressing needs, we're here. And that's kind of the role that we are fit into.
Yeah, you mentioned Harlem Hospital. That's the place of my birth. I was born in Harlem Hospital, and so grew up in St. Nick Projects right there on 127th Street, so I'm pretty familiar with the area. But I can say that growing up and remembering, there weren't a lot of facilities around to really be able to get the care. And as the years went on, and of course I moved out and came back, I also noticed that is a gap, and it is a gap. But what's it like for you being able to fill that gap and talk about really what makes the work that you guys do a little bit different than what we traditionally see?
I'm from Harlem. I went to City College biomedical program, and I did my rotations and a lot of my training at Harlem Hospital. I also worked at Harlem Hospital for about 5 years out of school, also Lincoln Hospital in the South Bronx. So I have family members that are in the area. And so I think that that resonates, being of the community and trained in the community, and then to then serve that community, that resonates with the patients of the community. There is COVID just worsened a gap that was already there. We had primary cares that closed, some older primary care providers, urgent care providers didn't make it through COVID. And so there was already a shortage, and then COVID just worsened that. And so what we found we opened up right after the first wave. And so what we basically found is that there's a huge need. So many people come in and say, my primary care just left, just moved, or I went to an unnamed urgent care up the street, and their wait time is 1.5 hours, 2 hours. So being able to fill that role for the surrounding community is really where we focus.
When we talk about racial equity, obviously, it's sometimes hard, when you look around New York City, particularly Harlem, urban areas, when it comes to racial equity in the field of health, it becomes challenging. We talk about COVID, right? We knew that COVID, there was that disparity that particularly affected communities of color when it came to COVID. And all it did was further shine the light on what was already there, and further exacerbated that. But talk to me about the work that you're doing right now, because in many ways it is kind of like closing the gap and bridging that gap.
Trying to. We are still in urgent care, and so our main mandates are the urgent issues, but so much of what we find ourselves doing is the primary care portion, the chronic management, or the management of chronic disease states like hypertension, diabetes, asthma, those things that take more than just one visit. So on top of already doing urgent care work, we're now doing, we're about to launch a primary care facility over on 139th and Frederick Douglass. We have a urgent care facility there. We're just expanding what we offer. We also are doing women's health, which is, if you watch the news at all, you know what kind of shortages are there as well. So just trying to hear what the community and our patient population is asking for, and then tailoring what we're offering to that community. And like I said, I have family members in this community. So aside from the business aspect, it really is trying to do as much as we can with whatever resources we have to fill those gaps.
I remember growing up and going to the doctor. It was very hard. I saw nurses and probably nursing assistants who were of color, but then to see actual doctor, to be of color, to see people who looked like you in those situations, few and far between. Give me, from your perspective, what that means to be able to see somebody that looks like you on the other side of that, on the other side of the bed.
Well, small correction. I'm a physician assistant. I went to the physician assistant program here at City College, but one of my main roles here at the urgent care group is recruiting. And so in my recruiting efforts, aside from being an experienced clinician, we look for people who have the cultural sensitivity to service our population. If you think about, all of us have a memory of being a child and going to the doctor and remembering it maybe being a traumatizing situation, or coming out of it hating needles for the rest of your life. In those moments, that is a chance for us on the other side of it to leave a lasting impression. And so part of that impression is our bedside manner and how we provide care, but it's also what you're seeing, and melding those two together are really make a difference over the course of a child's life, but and then into going into adulthood, knowing that, well, that doc looked like me, or looked like my uncle, or looked like my cousin, my favorite cousin, and knowing that they can also move into these fields as well. So it's important, and it's definitely not lost on us when we see our community.
Yeah. And so for yourself, doing this lead work and taking the lead on a lot of this, what is the hope and what's your takeaway that the community will be able to receive through the work that you do?
It's in these moments, it sometimes can feel or be perceived as, from the outside, that a lot of this is planned, and a lot of it is scheduled. But so much of it is really seeing what we're being asked of, and then trying to provide the services that are being asked for. And so going into it, COVID was the big demand. And so, increasing our COVID testing capabilities, access to medication, access to vaccines. But then, as now COVID numbers go down and testing stabilizes, we're getting more requests for the primary care, more requests for women's health, sexual health. And so with the role that I'm in, I'm able to not only hear it from the patient side, but then on the business side, speak to ownership and speak to leadership, and try to mesh the two and see what we can do with the resources we have. I also I mentor students from the local college here, City College, and the new PA students that are coming out, they rotate with me. And if I can make an impression on them that, doing the primary care work, doing the urgent care work is important, then it just sets things up, years down the line, hopefully.
Yeah. Well, a lot of times you're seeing a lot of things in urgent care. What are the things that we can do to better ourselves so that way we don't end up coming? I mean, of course, you got to do business. We don't want to keep your doors empty. But what can we do to better keep some things from coming through your doors?
Well, so much of health is what you're putting in, and so much of it is what you're asking of your body. And so, if you are putting in food that is not so nutritious, and then also living a sedentary lifestyle, then your body down regulates a lot of the processes, and that's when stuff starts to fall apart, starts to break apart. If you just modify even caloric intake, how your portion size is, and just adding a little bit of physical activity, even if it is uh, deciding to walk the 5 to 10 blocks to wherever you're going instead of, say, taking an Uber or jumping on the bus. Those small modifications, it doesn't have to be all done it doesn't have to be 5 days a week in the gym, but those small additions, taking the stairs to 3 flights instead of jumping on the elevator, those small things, they add up, and it turns into habits. And so, and when you change your habits, then it translates into just a better general or overall health picture. But really, sedentary lifestyle and greasy, not nutritious meal intake are some of the biggest factors in that affect so many things downstream: your immunity, weight, cholesterol, hypertension, all of those factors. So long answer short, lifestyle modifications, small ones, and just turning those things into habits.
Yeah. Well, Michael Budden, we got to leave it there. But thank you so much for sharing with us. I think it's important that we get those tips, and got to bring you back. Maybe you'll share some more so that we can live a more healthier lifestyle. But thank you for the work that you're doing, enriching the hometown. You don't understand. It does my heart good every time I see good things happen in Harlem. And you certainly are one of those people who are making a difference, and I appreciate you. So thanks for joining us, and thanks for being with us.
Yeah, I appreciate you taking the time to speak to me and about the stuff we're working on here. Come
Yeah.
down and see us.
No, I listen. That's a fact. An invitation to Harlem, I receive it. So anytime, brother, you got it. I'll definitely come and check you out. I appreciate you.
Thanks for talking to me.